Question 1. Research into developing a comprehensive workplace violence prevention program for a U.S. healthcare facility has identified several potential strategies. Which of the following approaches best aligns with regulatory frameworks and best practices for process optimization in this domain? Option A. Assigning the sole responsibility for developing and implementing the program to the facility's security department, with minimal input from other operational units. Option B. Establishing a program that emphasizes thorough post-incident investigations and robust disciplinary actions for perpetrators of violence. Option C. Focusing primarily on enhancing physical security measures such as reinforced doors, advanced surveillance systems, and strict access control protocols. Option D. Implementing a program that prioritizes proactive risk assessment, comprehensive staff training on de-escalation and threat recognition, clear reporting protocols, and a system for continuous program evaluation and improvement. Correct answer is D. Implementing a program that prioritizes proactive risk assessment, comprehensive staff training on de-escalation and threat recognition, clear reporting protocols, and a system for continuous program evaluation and improvement. Explanation. Scenario analysis. Developing a workplace violence prevention program in a healthcare setting presents unique challenges due to the inherent vulnerability of patients, the high-stress environment, and the diverse range of potential perpetrators, patients, visitors, staff. The program must be comprehensive, adaptable, and compliant with relevant healthcare security regulations, such as those mandated by the U.S. Department of Health and Human Services, HHS, and Occupational Safety and Health Administration, OSHA, guidelines for healthcare facilities. The challenge lies in balancing robust security measures with maintaining a therapeutic environment and respecting patient rights. Correct approach analysis. The most effective approach involves a multifaceted strategy that integrates proactive risk assessment, robust training, clear reporting mechanisms, and a culture of safety. This aligns with OSHA General Duty Clause, which requires employers to provide a workplace free from recognized hazards likely to cause death or serious physical harm, and specific OSHA guidance on preventing workplace violence in healthcare. A comprehensive program, as outlined in the correct option, emphasizes early identification of risks, de-escalation techniques, and post-incident analysis, all of which are critical for continuous improvement and regulatory compliance. This approach fosters a proactive security posture rather than a reactive one. Incorrect approach is analysis, an approach solely focused on physical barriers and access control, while important, is insufficient. It fails to address the human element, such as behavioral indicators of potential violence or the need for de-escalation training, which are crucial for preventing incidents before they escalate. This overlooks the proactive and preventative aspects required by regulatory frameworks that emphasize hazard identification and mitigation beyond mere physical security. An approach that relies exclusively on post-incident investigation and disciplinary action is reactive and fails to meet the preventative requirements of workplace violence prevention programs. Regulations and best practices mandate proactive measures to identify and mitigate risks before harm occurs. This approach also neglects the importance of creating a safe reporting environment and learning from near misses. An approach that delegates the entire responsibility for developing and implementing the program to a single department without interdisciplinary collaboration is flawed. Workplace violence prevention is a shared responsibility that requires input from clinical staff, security, human resources, and administration. This siloed approach can lead to gaps in understanding, implementation challenges, and a lack of buy-in, ultimately undermining the program's effectiveness and compliance with holistic safety mandates. Professional reasoning. Professionals should approach workplace violence prevention by first conducting a thorough risk assessment specific to their healthcare environment, considering patient populations, facility layout, and historical incident data. This assessment should inform the development of a program that includes clear policies and procedures, comprehensive staff training on recognizing and responding to potential threats, effective communication channels for reporting concerns, and a system for continuous evaluation and improvement. Collaboration across departments and a commitment to fostering a culture of safety are paramount for successful implementation and regulatory adherence. Question 2. The monitoring system demonstrates a consistent pattern of unauthorized access attempts to the electronic health record, server room during off hours, coupled with a recent increase in reported minor equipment tampering in patient care areas. A comprehensive vulnerability assessment is required. Which of the following approaches best addresses the identified security concerns in a healthcare environment? Option A. Prioritize immediate remediation of the EHR server room access attempts by enhancing access controls and surveillance, while simultaneously conducting a targeted assessment of equipment, tampering incidents to identify commonalities and potential root causes. Option B. Initiate a facility-wide security audit based on general security best practices without specific consideration for the observed patterns of attempted EHR access or equipment tampering. Option C. Immediately deploy additional security guards to patrol all patient care areas, as the equipment tampering incidents suggest a widespread internal threat. Option D. Focus exclusively on the EHR server room access attempts, as this represents the most critical potential data breach and should be the sole focus of the assessment. The correct answer is A. Prioritize immediate remediation of the EHR server room access attempts by enhancing access controls and surveillance, while simultaneously conducting a targeted assessment of equipment, tampering incidents to identify commonalities and potential root causes. Explanation: this scenario presents a common challenge in healthcare physical security, balancing the need for comprehensive vulnerability assessment with the practical constraints of a live, operational environment. The core difficulty lies in identifying potential security weaknesses without disrupting patient care, staff workflow, or compromising sensitive information. A successful vulnerability assessment requires a systematic, risk-based approach that prioritizes critical assets and potential threats, aligning with the principles of healthcare security management. The correct approach represents best professional practice because it directly addresses the identified vulnerabilities through a structured, prioritized plan. This aligns with the core tenets of healthcare physical security, which emphasize proactive risk mitigation and continuous improvement. By focusing on high-risk areas first and involving relevant stakeholders, this method ensures that resources are allocated effectively and that security enhancements are integrated seamlessly into the healthcare environment. This systematic approach is implicitly supported by industry best practices and the general principles of risk management expected of a certified healthcare physical security professional, CHPS. Even without referencing specific, non-existent CHPS regulations for this hypothetical exam, the emphasis is on a logical, evidence-based progression from identification to remediation. An incorrect approach that focuses solely on immediate, visible threats without a broader risk analysis fails to address underlying systemic weaknesses. This is professionally unacceptable because it is reactive rather than proactive, potentially leaving the facility vulnerable to less obvious but equally damaging threats. It also risks misallocating resources to low-impact issues while neglecting critical vulnerabilities. Another incorrect approach that prioritizes convenience over thoroughness, such as relying solely on anecdotal evidence or superficial observations, is professionally unsound. This leads to incomplete assessments and a false sense of security. It bypasses the systematic data collection and analysis required for effective risk management, a fundamental expectation for a CHPS. A third incorrect approach that involves implementing security measures without proper stakeholder consultation or consideration of operational impact is also professionally deficient. This can lead to resistance from staff, unintended disruptions to patient care, and the implementation of ineffective or even counterproductive security controls. Effective healthcare security requires collaboration and an understanding of the unique operational dynamics of a healthcare facility. The professional decision-making process for similar situations should involve a phased approach. First, a comprehensive risk assessment to identify potential threats and vulnerabilities. Second, a detailed vulnerability assessment to evaluate the effectiveness of existing controls. Third, prioritization of identified vulnerabilities based on risk level and potential impact. Fourth, development of a remediation plan with clear objectives, timelines, and resource allocation. And finally, implementation, monitoring, and continuous reevaluation of security measures. Throughout this process, open communication and collaboration with all relevant stakeholders, including clinical staff, IT, and administration, are paramount. Question 3. System analysis indicates a need to enhance physical security measures within a healthcare facility to address emerging threats. The facility is considering the rapid implementation of advanced surveillance technology and a new biometric access control system. Which of the following approaches best aligns with regulatory requirements and professional best practices for healthcare physical security? Option A. Immediately deploy the new surveillance technology and access control system based on vendor specifications to quickly bolster security presence. Option B. Prioritize the installation of new surveillance cameras across the facility, assuming this will deter most threats, and address policy and access control adjustments as a secondary concern. Option C. Conduct a comprehensive risk assessment. Review and update existing security policies and procedures to incorporate the new technologies, and ensure alignment with HIPAA security rule requirements before deployment. Option D. Implement the new access control system first, as it directly controls physical entry, and then address surveillance technology and policy updates later. The correct answer is C. Conduct a comprehensive risk assessment. Review and update existing security policies and procedures to incorporate the new technologies, and ensure alignment with HIPAA security rule requirements before deployment. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for enhanced security with the complex regulatory landscape governing healthcare facilities in the United States, specifically concerning patient privacy and data protection under HIPAA. The physical security professional must implement effective measures without inadvertently creating new vulnerabilities or violating established legal and ethical standards. The rapid deployment of new technology, while potentially beneficial, introduces risks related to data integrity, access control, and potential breaches, all of which have significant legal and operational ramifications. Correct approach analysis. The correct approach prioritizes a comprehensive risk assessment and policy review before implementing new security measures. This aligns with best practices mandated by healthcare regulations and industry standards. Specifically, it ensures that any new technology or procedure is evaluated against HIPAA security rule, which requires covered entities to implement appropriate administrative, physical, and technical safeguards to protect electronic protected health information, E5. A thorough risk assessment identifies potential vulnerabilities and ensures that the proposed solutions are proportionate to the identified risks. Reviewing and updating existing policies and procedures ensures that staff are properly trained and that the new measures are integrated seamlessly into the facility's operational framework, maintaining compliance and operational efficiency. This proactive, risk-based approach is the cornerstone of effective healthcare physical security and regulatory adherence. Incorrect approaches analysis. Implementing new surveillance technology without a prior risk assessment and policy update is a significant regulatory and ethical failure. This approach risks violating HIPAA by potentially capturing sensitive patient information without proper authorization or safeguards, leading to privacy breaches and substantial penalties. It also bypasses the necessary due diligence to ensure the technology is effective and integrated properly, potentially creating new security gaps or operational disruptions. Deploying new access control systems solely based on vendor recommendations, without internal validation or policy alignment, is another failure. This can lead to systems that are not interoperable with existing infrastructure, fail to meet specific facility needs, or create unintended access points. Ethically, it demonstrates a lack of due diligence in protecting patient information and facility assets. From a regulatory standpoint, it could result in non-compliance with HIPAA access control requirements if the system does not adequately protect EPHI. Focusing exclusively on perimeter security enhancements without considering internal access controls and data protection measures is incomplete. While external threats are important, internal threats and the protection of sensitive data within the facility are equally critical under HIPAA. This narrow focus neglects the comprehensive security requirements for healthcare environments and could leave patient data vulnerable to insider threats or accidental disclosure. Professional reasoning. Professionals in healthcare physical security must adopt a systematic, risk-based approach. This involves understanding the specific regulatory environment, in this case, U.S. federal regulations like HIPAA, conducting thorough risk assessments to identify vulnerabilities, and developing policies and procedures that address these risks effectively. When considering new technologies or security measures, The process should always involve evaluating their impact on patient privacy, data security, and operational workflows. Collaboration with IT, legal, and compliance departments is crucial to ensure that all security initiatives are compliant and integrated. The decision-making process should prioritize patient safety and privacy above all else, ensuring that security measures enhance, rather than compromise, the healthcare environment. Question 4. Which approach would be most effective in ensuring the physical security of a healthcare facility, aligning with U.S. regulatory requirements for protecting patient data and critical infrastructure? Option A. Focusing primarily on enhancing the aesthetic appeal and patient comfort of the facility, with security measures being secondary considerations. Option B. Conducting a comprehensive, facility-specific risk assessment to identify vulnerabilities and threats, and then implementing proportionate security controls based on the findings. Option C. Reacting to security incidents by immediately increasing visible security personnel and implementing ad hoc security measures. Option D. Implementing a broad range of security technologies and protocols based on general industry best practices for high-security environments. The correct answer is B. Conducting a comprehensive, facility-specific risk assessment to identify vulnerabilities and threats, and then implementing proportionate security controls based on the findings. Explanation. The scenario presents a common challenge in healthcare physical security, balancing robust protection of sensitive patient data and critical infrastructure with the need for accessibility and a welcoming environment for patients and visitors. The professional challenge lies in identifying the most effective and compliant method for assessing and mitigating physical security risks within a healthcare setting, adhering strictly to U.S. regulatory frameworks relevant to healthcare. Careful judgment is required to ensure that security measures are not only effective, but also proportionate, cost-efficient, and do not impede essential healthcare operations or patient care. The correct approach represents best professional practice because it directly aligns with the principles of a comprehensive risk assessment, a cornerstone of effective security management in healthcare. This approach emphasizes identifying vulnerabilities, analyzing threats, and evaluating the potential impact of security breaches. In the U.S. healthcare context, this aligns with guidelines from agencies like the Department of Health and Human Services, HHS, and the Office for Civil Rights, OCR, concerning the protection of protected health information, FI, under HIPAA. A systematic risk assessment ensures that security investments are prioritized based on actual risks, leading to more effective and compliant security postures. It also supports the development of a security plan that is tailored to the specific needs and risks of the healthcare facility, thereby enhancing patient safety and data integrity. An approach that focuses solely on reactive measures, such as simply increasing guard presence after an incident, represents a significant regulatory and ethical failure. This reactive stance fails to proactively identify and mitigate vulnerabilities, which is a core requirement of HIPAA security rule. It is also inefficient and costly, as it addresses symptoms rather than root causes. Furthermore, it may not adequately address the diverse range of physical security threats, including unauthorized access to PHI, theft of medical equipment, or disruption of critical services. An approach that prioritizes aesthetics and patient comfort over documented security risks is also professionally unacceptable. While a welcoming environment is important, it cannot come at the expense of essential security controls mandated by regulations like HIPAA. This approach neglects the fundamental responsibility to protect sensitive information and ensure the safety of patients and staff, potentially leading to breaches and regulatory penalties. It fails to conduct a proper risk assessment, which is the foundation for determining appropriate security measures. An approach that relies on industry best practices without a specific assessment of the facility's unique risks is insufficient. While general best practices are valuable, healthcare facilities have unique vulnerabilities and threat landscapes. Without a tailored risk assessment, security measures may be misapplied, leaving critical gaps or imposing unnecessary burdens. This approach fails to meet the requirement for a facility-specific security plan, which is implied by the need to protect PHI and ensure operational continuity. The professional decision-making process for similar situations should begin with a thorough understanding of the applicable U.S. regulatory landscape, particularly HIPAA and any state-specific healthcare security laws. This should be followed by a comprehensive, documented risk assessment that identifies assets, threats, vulnerabilities, and potential impacts. Based on the risk assessment, a layered security strategy should be developed, incorporating physical barriers, access controls, surveillance, personnel security, and emergency preparedness. This strategy must be regularly reviewed and updated to adapt to evolving threats and regulatory requirements. The process should also involve stakeholder engagement, including clinical staff, IT security, and administration, to ensure that security measures are practical and effective. Question 5. The review process indicates that historical security incident data is available for analysis. As a certified healthcare physical security professional, CHPS, which approach to analyzing this data would best inform future security strategies and demonstrate adherence to professional standards? Option A. Identify recurring incident types and locations to pinpoint systemic vulnerabilities and assess the effectiveness of current security controls. Option B. Prioritize incidents based on the subjective opinions of senior staff regarding their perceived severity. Option C. Focus on the total number of incidents reported each quarter to demonstrate a general trend in security activity. Option D. Compile a list of all incidents without further analysis to serve as a comprehensive record. The correct answer is A. Identify recurring incident types and locations to pinpoint systemic vulnerabilities and assess the effectiveness of current security controls. Explanation. The review process indicates a need to analyze historical security incident data to improve future healthcare physical security. This scenario is professionally challenging because it requires not only data interpretation, but also the application of that interpretation to a complex, regulated environment where patient safety and privacy are paramount. The challenge lies in moving beyond simple data aggregation to actionable insights that comply with healthcare regulations and ethical standards. The correct approach represents best professional practice because it directly addresses the need for proactive risk mitigation and continuous improvement, which are core tenets of healthcare security management. By focusing on identifying trends, root causes, and the effectiveness of existing controls, security professionals can make data-driven decisions that enhance the overall security posture. This aligns with the principles of due diligence and the ethical obligation to protect patients and staff, as implicitly or explicitly required by healthcare security standards and best practices, which emphasize a risk-based approach to security. An incorrect approach that focuses solely on the frequency of incident without considering context or root cause fails to provide actionable intelligence. This is a regulatory and ethical failure because it neglects the fundamental purpose of incident analysis, which is to learn and prevent recurrence. It also fails to demonstrate due diligence in identifying systemic vulnerabilities. Another incorrect approach that prioritizes anecdotal evidence over systematic data analysis is also a failure. This is ethically problematic as it can lead to biased decision-making and misallocation of resources, potentially leaving critical vulnerabilities unaddressed. Furthermore, it fails to meet the professional standard of evidence-based practice in security management. An approach that solely focuses on reporting metrics without translating them into strategic improvements is a failure to fulfill the professional responsibility of proactive risk management. This can lead to a false sense of security and continued exposure to preventable incidents, which is an ethical lapse in protecting the healthcare environment. Professionals should use a decision-making framework that begins with clearly defining the objectives of the data analysis. This involves identifying what specific security concerns or areas for improvement the historical data should address. Next, the framework requires selecting appropriate analytical methods that can uncover trends, patterns, and root causes, rather than just surface-level statistics. Crucially, the analysis must be contextualized within the specific healthcare environment, considering factors like patient demographics, facility layout, and operational workflows. Finally, the insights derived must be translated into concrete, actionable recommendations that are prioritized based on risk and feasibility, and then communicated effectively to stakeholders for implementation and ongoing monitoring. Question 6. The analysis reveals that a large urban hospital is experiencing increasing challenges in coordinating its physical security response with local law enforcement and emergency medical services during active threat incidents. The security director is tasked with improving this coordination. Which of the following implementation strategies would best address this challenge and align with best practices for healthcare physical security? Option A. Develop a comprehensive internal emergency response plan that details the hospital's security protocols and distribute it to local law enforcement and EMS agencies, expecting them to integrate it into their own response strategies. Option B. Rely on the existing mutual aid agreements between the city and the hospital, assuming that local law enforcement and EMS will automatically understand the hospital's specific security needs and operational procedures during an incident. Option C. Establish a dedicated liaison officer from the hospital security department to regularly engage with local law enforcement and EMS command staff, share updated facility blueprints and emergency contact lists, and participate in their departmental training exercises. Option D. Create a single, primary contact person within the hospital security department who will be the sole point of communication for all external agencies during an emergency, without prior established relationships or joint planning. Correct answer is C. Establish a dedicated liaison officer from the hospital security department to regularly engage with local law enforcement and EMS command staff, share updated facility blueprints and emergency contact lists, and participate in their departmental training exercises. Explanation. This scenario presents a common implementation challenge in healthcare physical security, establishing and maintaining effective coordination with external agencies, specifically local law enforcement and emergency medical services, EMS. The challenge lies in bridging the gap between internal security protocols and the operational realities, communication methods, and response priorities of these external entities. A healthcare facility security team must proactively build relationships, understand mutual operational needs, and develop integrated response plans that are tested and refined. This requires more than just a reactive approach. It demands a strategic, collaborative effort. The correct approach represents best professional practice because it prioritizes a structured, ongoing, and mutually beneficial relationship. This involves not only establishing initial contact, but also conducting joint training exercises, sharing relevant facility information like floor plans and access points, and establishing clear communication channels and protocols. Such a proactive stance aligns with the principles of robust emergency preparedness and response, which are implicitly or explicitly supported by healthcare regulations and best practices aimed at ensuring patient safety and continuity of operations during crises. This approach fosters trust, improves situational awareness for all parties, and ultimately enhances the effectiveness of incident response, minimizing potential harm and disruption. An incorrect approach that relies solely on a single point of contact without regular engagement fails to build a comprehensive understanding of each agency's capabilities and limitations, nor does it ensure that the healthcare facility's unique needs are understood by external responders. This can lead to miscommunication, delayed or inappropriate responses during an actual event, and a lack of integration during critical moments. It also neglects the ethical responsibility to ensure the highest level of safety for patients and staff. Another incorrect approach that focuses only on providing basic contact information without establishing pre-incident agreements or joint planning overlooks the critical need for predefined roles, responsibilities, and communication strategies. This reactive posture can result in confusion and inefficiency when seconds count. It also fails to meet the spirit of collaborative emergency management that is essential for a well-functioning healthcare system. Finally, an approach that assumes external agencies will independently understand the healthcare facility's security needs and operational environment is a significant oversight. Healthcare facilities have unique vulnerabilities and operational considerations that require explicit communication and integration with external response plans. Failing to proactively educate and collaborate with law enforcement and EMS can lead to ineffective interventions, potential damage to sensitive areas, and compromised patient care during an emergency. The professional decision-making process for similar situations should involve a systematic assessment of potential threats and vulnerabilities, followed by the identification of key external stakeholders. A proactive engagement strategy should then be developed, focusing on building relationships, establishing clear communication protocols, and conducting joint planning and training. Regular review and updates to these collaborative efforts are crucial to ensure their continued effectiveness. Question 7. The efficiency study reveals that the current physical security surveillance system at a large urban hospital is outdated and has significant blind spots. The security director must recommend a replacement strategy, considering both enhanced security posture and adherence to U.S. federal healthcare regulations. Which of the following approaches best aligns with a risk-based methodology for selecting new surveillance technologies? Option A. Conduct a thorough risk assessment to identify critical assets, vulnerabilities, and potential threats, then select surveillance technologies that directly mitigate these identified risks in a cost-effective and compliant manner. Option B. Focus on replacing existing CCTV cameras with the cheapest available analog models to maximize immediate cost savings and minimize disruption. Option C. Implement a phased upgrade, starting with areas identified as having the highest foot traffic, without a formal risk assessment, assuming these are the most critical. Option D. Prioritize the acquisition of the most advanced IP camera system available, regardless of cost, to ensure comprehensive coverage and future-proofing. The correct answer is D. Prioritize the acquisition of the most advanced IP camera system available, regardless of cost, to ensure comprehensive coverage and future-proofing. Explanation: this scenario presents a common challenge in healthcare physical security, balancing the need for comprehensive surveillance with the practicalities of budget constraints and technological integration. The professional challenge lies in selecting the most effective and compliant surveillance technologies that meet the specific security needs of a healthcare facility, adhering strictly to U.S. federal regulations and healthcare-specific guidelines. This requires a thorough risk assessment that considers not only the types of threats, but also the legal and ethical implications of data collection and retention. The correct approach represents best professional practice because it prioritizes a systematic, risk-based methodology. This involves identifying critical assets and vulnerabilities, then selecting technologies that directly address those identified risks in a manner compliant with regulations like HIPAA security rule, which mandates appropriate administrative, physical, and technical safeguards for electronic protected health information, EFI. A risk assessment ensures that resources are allocated effectively to mitigate the most significant threats, rather than simply deploying the latest technology. This aligns with the principles of due diligence and prudent management expected of a certified healthcare physical security professional. Incorrect approaches fail by either overemphasizing cost without adequate risk consideration, or by adopting a reactive stance rather than a proactive, risk-driven one. Deploying a system solely based on the lowest cost without a commensurate risk assessment could leave critical areas unprotected, violating the duty to provide adequate security. Conversely, selecting a system based on a perceived best technology without a specific threat analysis might lead to unnecessary expenditure on features not required for the facility's unique risks, and could potentially introduce new vulnerabilities if not properly integrated and managed. Furthermore, any surveillance system must consider data privacy and retention policies that comply with HIPAA and other relevant U.S. privacy laws, ensuring that collected data is handled ethically and legally. Failure to integrate these considerations into the technology selection process constitutes a significant regulatory and ethical failure. The professional decision-making process for similar situations should begin with a comprehensive threat and vulnerability assessment specific to the healthcare environment. This assessment should inform the selection of surveillance technologies, prioritizing those that offer the best return on investment in terms of risk mitigation. Compliance with all applicable U.S. federal and state regulations, particularly those pertaining to patient privacy and data security, e.g., HIPAA, must be a foundational element of the decision-making process. Regular review and re-evaluation of the surveillance strategy are also crucial to adapt to evolving threats and technological advancements. Question 8. Quality control measures reveal that a new advanced biometric access control system is being considered for deployment across multiple sensitive areas of a healthcare facility, including patient records departments and medication storage rooms. The system promises enhanced security, but has not undergone a thorough risk assessment specific to its integration into the existing healthcare IT infrastructure and physical security protocols. Which of the following approaches best represents a compliant and effective strategy for developing risk mitigation strategies for this new technology? Option A. Conduct a comprehensive risk assessment to identify potential vulnerabilities, develop specific mitigation strategies addressing technical, administrative, and physical controls, and create an incident response plan tailored to the new system, ensuring alignment with HIPAA security rules. Option B. Focus exclusively on the technical specifications and capabilities of the biometric system, assuming that its advanced nature inherently mitigates all potential security risks. Option C. Proceed with the installation of the biometric system immediately, relying on the vendor's basic security features and addressing any security incidents reactively as they occur. Option D. Implement the biometric system and then initiate a risk assessment process, prioritizing mitigation efforts only after the system has been fully deployed and initial security issues have been observed. Correct answer is A. Conduct a comprehensive risk assessment to identify potential vulnerabilities, develop specific mitigation strategies addressing technical, administrative, and physical controls, and create an incident response plan tailored to the new system, ensuring alignment with HIPAA security rules. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare physical security, balancing the need for robust security measures with the operational demands and patient experience within a healthcare facility. The introduction of new technology, while potentially enhancing security, also introduces new vulnerabilities and requires careful consideration of its impact on existing workflows, staff training, and patient privacy. The professional challenge lies in developing risk mitigation strategies that are effective, compliant with healthcare regulations, and practical for implementation without unduly disrupting patient care or creating new security risks. Correct approach analysis. The correct approach involves a systematic, multifaceted risk assessment and mitigation planning process. This begins with a thorough evaluation of the new technology's security implications, including potential failure points, unauthorized access vectors, and data breach risks. It then necessitates developing specific actionable mitigation strategies that address these identified risks. This includes implementing technical controls, e.g., access controls, encryption, administrative controls, e.g., policies, procedures, training, and physical controls, e.g., secure placement, environmental monitoring. Crucially, this process must align with relevant healthcare regulations, such as HIPAA in the U.S., which mandates the protection of protected health information. 5. The development of a comprehensive incident response plan for the new technology is also a critical component, ensuring preparedness for potential security events. This holistic approach ensures that risks are proactively managed, compliance is maintained, and the security posture is strengthened without compromising patient care or privacy. Incorrect approaches analysis. Implementing the new technology without a comprehensive risk assessment and mitigation plan is a significant regulatory and ethical failure. This approach ignores the fundamental requirement to protect patient data and facility assets, directly contravening principles of due diligence and risk management expected of healthcare security professionals. It also fails to comply with regulations like HIPAA, which require risk analyses and the implementation of security safeguards. Focusing solely on the technical capabilities of the new technology without considering its integration into the existing security framework and operational environment is another failure. This narrow focus can lead to the creation of new vulnerabilities at the interfaces between systems or through inadequate staff training, thereby increasing the overall risk profile. It neglects the administrative and physical control aspects essential for a layered security approach. Adopting a wait-and-see approach after implementation, relying on reactive measures to address security issues as they arise, is professionally irresponsible and ethically unsound. This reactive stance is contrary to the proactive risk management principles mandated by security best practices and regulatory frameworks. It significantly increases the likelihood of security breaches, data loss, and potential harm to patients, leading to severe legal and reputational consequences. Professional reasoning. Healthcare physical security professionals should employ a structured decision-making framework for developing risk mitigation strategies. This framework typically involves 1. Identification. Proactively identify potential threats and vulnerabilities associated with new technologies or changes in the environment. 2. Assessment. Analyze the likelihood and impact of identified risks, prioritizing them based on potential severity. 3. Mitigation. Develop and implement a range of controls, technical, administrative, physical, to reduce risks to an acceptable level. 4. Monitoring and review. Continuously monitor the effectiveness of implemented controls and periodically review the risk assessment to adapt to evolving threats and technologies. 5. Documentation. Maintain thorough records of all risk assessment, mitigation plans, and control implementations for compliance and auditing purposes. This systematic process ensures that decisions are evidence-based, compliant, and aligned with the overarching goal of protecting patients, staff, and sensitive information within the healthcare environment. Question 9. During the evaluation of a new access control system for a large urban hospital, the security director is considering several options. The hospital has distinct zones including patient care units, a highly sensitive research laboratory, administrative offices, and a public waiting area. The director needs to ensure compliance with HIPAA and maintain efficient patient flow. Which of the following approaches best balances security, operational efficiency, and regulatory compliance? Option A. Implementing a multi-factor authentication system, e.g., card swipe, PIN, and biometric scan for all entry points into the facility, including the public waiting area and administrative offices. Option B. Selecting the least expensive access control system that meets basic entry and exit requirements, assuming that staff training will compensate for any security gaps. Option C. Designing a layered access control strategy where higher security measures, such as multi-factor authentication, are applied to critical areas like the research laboratory and medication storage, while lower-level controls, such as key card access with audit trails, are used for patient care units and administrative offices, and basic visitor management for public areas. Option D. Focusing solely on a system that provides the most advanced biometric identification technology for all doors, regardless of the sensitivity of the area or the potential impact on patient care workflow. The correct answer is A. Implementing a multi-factor authentication system, e.g., card swipe, PIN, and biometric scan, for all entry points into the facility, including the public waiting area and administrative offices. Explanation. This scenario presents a common challenge in healthcare physical security, balancing robust access control with the operational needs of a busy, multidisciplinary facility, while adhering to stringent healthcare regulations. The primary challenge lies in ensuring that access controls do not impede critical patient care or emergency response, yet effectively prevent unauthorized access to sensitive areas. The need to comply with regulations like HIPAA, Health Insurance Portability and Accountability Act, regarding patient privacy and data security, as well as facility-specific security standards, adds layers of complexity. Careful judgment is required to select a system that is both effective and practical. The correct approach represents best professional practice because it prioritizes a layered security strategy that is tailored to the specific risks and operational requirements of each zone within the healthcare facility. This involves a risk-based assessment to determine the appropriate level of access control for different areas, such as patient rooms, medication storage, administrative offices, and critical infrastructure. Implementing a system that integrates multiple authentication factors, e.g., card, PIN, biometric, for high-security areas, while using simpler methods for low-risk zones, demonstrates a comprehensive and proportionate security posture. This approach aligns with the principles of security design that advocate for defense in depth and is consistent with the spirit of regulations aimed at protecting patient information and ensuring facility safety. An incorrect approach that relies solely on a single, high-security access method for all areas is professionally unacceptable. This fails to acknowledge the varying risk profiles of different zones and can lead to operational inefficiencies, increased costs, and potential frustration for staff, which could inadvertently compromise security through workarounds. It also fails to meet the regulatory expectation of a risk-based approach to security, potentially leading to overprotection in some areas and underprotection in others. Another incorrect approach that focuses only on cost-effectiveness without a thorough risk assessment is also professionally unacceptable. Security is not merely a cost center. It is a critical component of patient safety and regulatory compliance. Prioritizing the cheapest option over a demonstrably effective and compliant solution can expose the facility to significant risks, including data breaches, theft, and harm to patients, which would have far greater financial and reputational consequences than a properly implemented security system. This approach violates the ethical obligation to protect patients and their sensitive information. A third incorrect approach that ignores the need for integration with other security systems, such as surveillance and alarm systems, is also professionally unacceptable. Access control is most effective when it is part of a holistic security ecosystem. Failing to integrate these systems limits the ability to monitor access events, respond to breaches, and conduct thorough investigations. This fragmented approach can create blind spots and reduce the overall effectiveness of the security program, potentially leading to noncompliance with regulations that require comprehensive security measures. The professional decision-making process for similar situations should involve a systematic risk assessment, followed by the development of a security plan that addresses identified risks. This plan should consider the specific regulatory requirements, operational needs, and the physical layout of the facility. Engaging stakeholders from various departments, IT, clinical staff, administration, is crucial to ensure the chosen solutions are practical and effective. Finally, continuous evaluation and adaptation of the security system are necessary to maintain its effectiveness against evolving threats and regulatory changes. Question 10. Quality control measures reveal that the healthcare facility surveillance footage is being stored on a network server with limited access controls, and the retention policy is to keep all footage indefinitely. Which of the following approaches best aligns with regulatory requirements for data storage and management of surveillance footage in a healthcare setting? Option A. Implement a robust encryption strategy for all stored footage. Establish role-based access controls for authorized personnel only, and define a clear retention schedule based on legal and operational requirements, ensuring regular secure disposal of outdated footage. Option B. Utilize cloud-based storage with strong vendor security certifications, and grant access to all facility department heads to review footage relevant to their operations. Option C. Store footage on individual security workstations with local storage, and allow any security staff member to delete footage they deem unnecessary to reduce storage costs. Option D. Store all surveillance footage on a separate, air-gapped server with no network connectivity, and retain it indefinitely to ensure maximum availability for any potential future investigation. The correct answer is A. Implement a robust encryption strategy for all stored footage, establish role-based access controls for authorized personnel only, and define a clear retention schedule based on legal and operational requirements, ensuring regular secure disposal of outdated footage. Explanation. This scenario is professionally challenging because it requires balancing the operational needs of a healthcare facility with stringent data privacy regulations, specifically concerning the storage and management of surveillance footage. The sensitive nature of patient information and the potential for breaches necessitate a robust and compliant approach to video data. Careful judgment is required to ensure that security measures do not inadvertently compromise patient privacy or violate legal mandates. The correct approach represents best professional practice because it directly addresses the core requirements of data integrity, access control, and retention periods as mandated by relevant healthcare regulations. By implementing a system that encrypts data both in transit and at rest, restricts access to authorized personnel only, and adheres to a defined retention schedule based on legal and operational needs, the facility demonstrates a commitment to compliance and the protection of sensitive information. This proactive stance minimizes the risk of data breaches and ensures that the surveillance system serves its intended security purpose without creating new vulnerabilities. An incorrect approach that involves storing footage unencrypted on accessible network drives is a significant regulatory and ethical failure. This practice violates data protection principles by exposing sensitive video data to unauthorized access, potentially including patient-identifiable information. It directly contravenes regulations that mandate the confidentiality and security of protected health information. 5. Another incorrect approach, which is to retain footage indefinitely without a clear policy or justification, is also problematic. This creates an unnecessary data management burden, increases the risk of long-term data compromise, and may violate data minimization principles inherent in many privacy laws. Furthermore, it can lead to legal complications if footage is retained beyond legally permissible periods, or if it becomes difficult to retrieve specific relevant footage when required for investigations or legal proceedings. A third incorrect approach, which is to grant broad access to all facility staff, regardless of their role or need to know, represents a severe breach of access control protocols. This significantly increases the likelihood of unauthorized viewing, misuse of footage, or accidental deletion, thereby violating privacy regulations and compromising the integrity of the surveillance system. Professionals should employ a decision-making framework that prioritizes understanding the specific regulatory landscape governing healthcare data in their jurisdiction. This involves identifying all applicable laws and guidelines related to data privacy, security, and retention. Subsequently, they must assess the operational requirements of the surveillance system and how they align with these legal obligations. A risk-based approach is crucial, identifying potential vulnerabilities in data storage and management and implementing controls to mitigate these risks. Regular audits and reviews of data management practices are essential to ensure ongoing compliance and to adapt to evolving threats and regulatory changes. Question 11. The evaluation methodology shows that a healthcare facility is considering upgrading its surveillance system. Which approach best aligns with a comprehensive risk assessment framework for determining the scope and deployment of new surveillance technologies? Option A. Conducting a thorough risk assessment to identify specific threats, vulnerabilities, and critical assets, then designing the system to address these findings. Option B. Implementing a system based on competitor facility surveillance strategies without a site-specific analysis. Option C. Focusing surveillance efforts solely on perimeter security to prevent unauthorized external access. Option D. Prioritizing the installation of the most advanced camera models in all patient care areas to maximize visual coverage. The correct answer is D. Prioritizing the installation of the most advanced camera models in all patient care areas to maximize visual coverage. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the need for effective surveillance to mitigate risks against the potential for overreach, privacy concerns, and the efficient allocation of resources within a healthcare setting. The healthcare environment presents unique sensitivities due to patient privacy, HIPAA in the U.S. context, and the need to maintain a therapeutic atmosphere, making surveillance system design and implementation a complex ethical and regulatory undertaking. Correct approach analysis. The correct approach, which involves a comprehensive risk assessment that prioritizes identified threats and vulnerabilities, represents best professional practice because it is directly aligned with the principles of effective security management and regulatory compliance. In the U.S., the Health Insurance Portability and Accountability Act, HIPAA, security rule mandates that covered entities' conduct risk analyzes to identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information, EFI. A risk-based approach ensures that surveillance resources are deployed where they are most needed to protect patients, staff, and assets, thereby addressing potential threats such as unauthorized access, theft, or violence. This methodology ensures that the surveillance system is not only effective but also proportionate to the identified risks, avoiding unnecessary expenditure and minimizing privacy intrusions. Incorrect approaches analysis. Implementing a surveillance system based solely on the latest available technology without a prior risk assessment is professionally unacceptable. This approach fails to address the specific security needs of the healthcare facility, potentially leading to misallocation of resources on features that do not mitigate identified risks. Ethically, it can result in unnecessary surveillance that infringes on patient and staff privacy without a clear security justification, potentially violating principles of proportionality and necessity. From a regulatory standpoint, it bypasses the mandated risk analysis requirement under HIPAA, exposing the organization to compliance violations. Deploying surveillance cameras only in high-traffic public areas without considering other potential risk points is also professionally unsound. This approach is reactive rather than proactive and overlooks vulnerabilities in less public but equally critical areas, such as medication storage, sensitive patient records, or administrative offices. Such a limited scope fails to provide comprehensive security coverage and may not adequately address threats that could originate or manifest in these overlooked areas, thereby failing to meet the due diligence expected in a healthcare security program. Focusing exclusively on deterring external threats while neglecting internal risks, such as staff misconduct or patient-on-patient incidents, represents a significant gap in a comprehensive surveillance strategy. A robust security program must address all potential threat vectors. Ignoring internal risks can lead to undetected policy violations, theft, or harm, undermining the overall safety and security of the healthcare environment. This narrow focus, fails to meet the holistic risk management expectations for a healthcare facility. Professional reasoning. Healthcare physical security professionals must adopt a systematic, risk-based approach to surveillance system design and implementation. This involves first conducting a thorough threat and vulnerability assessment specific to the healthcare environment, considering both internal and external factors. The findings of this assessment should then inform the selection and placement of surveillance technologies, ensuring that the system directly addresses identified risks in a proportionate manner. Continuous evaluation and adaptation of the surveillance strategy based on evolving threats and regulatory requirements are also crucial. This methodical process ensures that security investments are effective, compliant with regulations like HIPAA, and ethically sound, prioritizing the safety and privacy of all individuals within the facility. Question 12. Regulatory review indicates that a comprehensive approach to identifying potential threats to healthcare facilities is paramount. Considering the unique operational environment and patient population, which of the following methodologies best supports a proactive and effective threat identification process for a healthcare organization? Option A. Prioritizing security enhancements based on the perceived threat level reported in national news media. Option B. Solely relying on a review of past security incidents and reported breaches within the facility. Option C. Conducting a detailed impact assessment that evaluates the potential consequences and likelihood of various threat scenarios relevant to healthcare operations. Option D. Implementing security technologies that are currently trending in the broader security industry, regardless of specific facility needs. The correct answer is C. Conducting a detailed impact assessment that evaluates the potential consequences and likelihood of various threat scenarios relevant to healthcare operations. Explanation. Scenario analysis. This scenario presents a common challenge in healthcare physical security, balancing the need for robust threat identification with the practical constraints of limited resources and the dynamic nature of potential threats. Healthcare facilities are complex environments with unique vulnerabilities, including the presence of sensitive patient data, valuable medical equipment, and a diverse population of patients, staff, and visitors, some of whom may be in distress or exhibit unpredictable behavior. The professional challenge lies in systematically assessing these vulnerabilities and anticipating potential threats without succumbing to alarmism or overlooking critical risks. A thorough impact assessment is crucial to prioritize security measures effectively and allocate resources where they will have the greatest protective effect. Correct approach analysis. The correct approach involves a systematic, multifaceted impact assessment that considers the likelihood and potential severity of various threats. This aligns with best professional practices in healthcare security management, which emphasize a risk-based approach. By evaluating the potential consequences of a threat e.g., patient harm, data breach, operational disruption, reputational damage, and the probability of its occurrence, security professionals can prioritize mitigation strategies. This methodology is implicitly supported by general principles of security management and risk assessment, which are foundational to the CHPS certification. While specific CHPS regulations might not detail every threat category, the underlying principle of informed, risk-based decision-making is paramount. This approach ensures that security investments are targeted and effective, contributing to the overall safety and security of the facility and its occupants. Incorrect approaches analysis. Focusing solely on historical incidents without considering emerging threats or evolving vulnerabilities is a regulatory and ethical failure. It represents a reactive rather than proactive security posture, potentially leaving the facility exposed to new or amplified risks. This approach neglects the dynamic nature of the threat landscape. Prioritizing security measures based on media sensationalism or anecdotal reports without a structured impact assessment is also professionally unacceptable. This can lead to misallocation of resources, addressing perceived threats that have a low actual impact while neglecting more significant risks. It lacks the objective, data-driven foundation required for effective security planning and may violate ethical obligations to protect the facility and its occupants based on a rational assessment of risk. Implementing security measures based on the most expensive or technologically advanced solutions without a clear link to identified threats or their potential impact is a failure of due diligence and fiscal responsibility. This approach can lead to inefficient spending and may not adequately address the most critical vulnerabilities. It bypasses the essential step of understanding the specific risks the facility faces, thus failing to meet the core objective of enhancing security where it is most needed. Professional reasoning. Healthcare physical security professionals should adopt a systematic risk management framework. This involves 1. Threat identification, brainstorming and researching potential threats relevant to healthcare environments, e.g., active shooter, patient elopement, insider threats, natural disasters, cyber-physical attacks. 2. Vulnerability assessment, identifying weaknesses in the facility's physical infrastructure, operational procedures, and human factors that could be exploited by identified threats. 3. Impact assessment, evaluating the potential consequences of each threat materializing, considering factors like patient safety, data integrity, operational continuity, financial loss, and reputational damage. 4. Likelihood assessment, estimating the probability of each threat occurring. 5. Risk prioritization, combining impact and likelihood to rank risks and determine which require immediate attention. 6. Mitigation strategy development, designing and implementing security controls and procedures to reduce the likelihood or impact of prioritized risks. 7. Continuous monitoring and review, regularly reassessing threats, vulnerabilities, and the effectiveness of security measures. This structured approach ensures that security efforts are focused, efficient, and aligned with the specific needs and risks of the healthcare facility, adhering to the principles of professional responsibility and due care. Question 13. System analysis indicates that a healthcare facility is undertaking the development of its emergency response plan. Which of the following approaches best aligns with regulatory requirements and best practices for ensuring comprehensive and effective preparedness? Option A. Creating a highly detailed and complex plan that outlines every conceivable scenario, even those with extremely low probability, to ensure absolute coverage. Option B. Developing a plan based on a thorough hazard vulnerability analysis, with input from a multidisciplinary team representing all critical operational areas, and incorporating regular training and updates. Option C. Relying on a generic emergency response template downloaded from an online resource and adapting it with minimal modifications. Option D. Assigning the sole responsibility for plan development to the facility's security department, with limited consultation from other departments. Correct answer is B. Developing a plan based on a thorough hazard vulnerability analysis, with input from a multidisciplinary team representing all critical operational areas, and incorporating regular training and updates. Explanation. Scenario analysis. Developing emergency response plans for healthcare facilities presents a significant professional challenge due to the inherent complexity of healthcare environments. The diverse range of potential emergencies, natural disasters, active threats, public health crises, and the critical need to protect vulnerable patient populations, staff, and sensitive medical equipment. Effective planning requires a comprehensive understanding of regulatory mandates, operational interdependencies, and the human element of crisis management. Careful judgment is required to balance preparedness with resource limitations, and to ensure plans are both robust and adaptable. Correct approach analysis. The most effective approach involves a multidisciplinary, collaborative development process that integrates input from all relevant departments, including clinical staff, facilities management, security, IT, and administration. This approach ensures that the plan addresses the unique needs and operational realities of each area within the facility. It aligns with best practices for emergency preparedness, which emphasize stakeholder engagement and the development of actionable, facility-specific protocols. Such a collaborative effort is crucial for compliance with regulations like the Health Insurance Portability and Accountability Act, HIPAA, Security Rule, which mandates contingency planning to protect electronic protected health information, E-FI, during emergencies, and the Emergency Medical Treatment and Labor Act, EMTALA, which requires hospitals to provide appropriate medical screening and stabilizing treatment to individuals with emergency medical conditions, regardless of their ability to pay. Ethical considerations also demand that patient safety and continuity of care are paramount, necessitating input from those directly involved in patient care. Incorrect approaches analysis. One incorrect approach is to solely rely on generic, off-the-shelf emergency response templates without customization. This fails to account for the specific layout, patient demographics, critical infrastructure, and unique operational workflows of the healthcare facility. It can lead to plans that are impractical, incomplete, or fail to address critical vulnerabilities, potentially violating regulatory requirements for facility-specific risk assessments and preparedness. Another incorrect approach is to delegate the entire planning process to a single department, such as security, without adequate consultation or buy-in from other key stakeholders. This siloed approach overlooks the critical operational and clinical perspectives necessary for a comprehensive and effective plan. It can result in plans that are technically sound from a security standpoint, but unworkable or detrimental to patient care and other essential functions, thereby failing to meet the holistic preparedness standards expected of healthcare organizations. Third incorrect approach is to develop a plan that is overly complex and difficult to implement during a high-stress event. While thoroughness is important, a plan that is too cumbersome, requires extensive training beyond practical capabilities, can become a liability rather than an asset. This can lead to confusion and delayed responses, potentially compromising patient safety and violating the ethical obligation to provide timely and effective care during emergencies. Professional reasoning. Professionals should adopt a systematic, risk-based approach to emergency response plan development. This begins with a thorough hazard vulnerability analysis, HVA, specific to the facility and its geographic location. Following the HVA, a collaborative planning team should be established, comprising representatives from all critical operational areas. The plan should then be developed iteratively, incorporating input from this team and referencing relevant federal regulations such as those from the Department of Health and Human Services, HHS, concerning emergency preparedness for healthcare providers, and guidelines from agencies like the Federal Emergency Management Agency, FEMA, for disaster planning. The plan must clearly define roles, responsibilities, communication protocols, evacuation procedures, and continuity of operations strategies. Regular training, drills, and exercises are essential to validate the plan's effectiveness and ensure staff proficiency. Finally, the plan should be reviewed and updated periodically or after any significant incident or change in facility operations. Question 14. The assessment process reveals that the healthcare facility's current policy for granting and revoking access to sensitive areas and patient information relies heavily on verbal requests and informal approvals from department heads, with no standardized documentation or a clear timeline for access removal upon employee termination. Which of the following approaches best addresses this critical security vulnerability in accordance with healthcare physical security, best practices, and regulatory expectations? Option A. Implement a formal documented access request and approval system that requires written justification for access, clearly defines roles and responsibilities, and mandates a documented process for timely revocation of access upon termination or change in job function. Coupled with regular access audits. Option B. Introduce a new biometric access system for all sensitive areas and rely on the system's inherent security features to manage access, while maintaining the existing informal request and revocation processes. Option C. Develop a comprehensive list of all personnel with access and have them re-sign a general confidentiality agreement annually, without changing the existing request and revocation procedures. Option D. Continue with the current informal system, but provide additional training to department heads on the importance of access control and the potential risks involved. The correct answer is A. Implement a formal documented access request and approval system that requires written justification for access, clearly defines roles and responsibilities, and mandates a documented process for timely revocation of access upon termination or change in job function, coupled with regular access audits. Explanation. The assessment process reveals a critical vulnerability in the healthcare facility's access control system, specifically concerning the policies for granting and revoking access. This scenario is professionally challenging because it directly impacts patient safety, staff security, and regulatory compliance. The sensitive nature of healthcare environments necessitates robust and meticulously managed access controls to prevent unauthorized entry into patient care areas, medication storage, and sensitive data repositories. A lapse in these policies can lead to breaches of privacy, theft of medical supplies or equipment, and even direct harm to patients. The correct approach represents best professional practice because it establishes a clear, documented, and consistently applied process for access management that aligns with regulatory expectations for healthcare security. This involves a multifaceted strategy that includes thorough vetting, defined roles and responsibilities, regular audits, and a timely revocation process. Such a system ensures that access is granted only to individuals who require it for legitimate job functions and is promptly removed when that need ceases, thereby minimizing risk. This proactive and systematic approach is fundamental to maintaining a secure healthcare environment and is implicitly or explicitly supported by healthcare security standards and best practices, which emphasize accountability and risk mitigation. An incorrect approach that relies solely on informal requests or lacks a formal, documented process for granting access is a significant regulatory and ethical failure. It bypasses necessary due diligence, increasing the risk of unauthorized access by individuals who have not been properly vetted. This can violate patient privacy regulations, e.g., HIPAA in the U.S., if applicable to the exam's jurisdiction, and compromise the integrity of the facility's security posture. Another incorrect approach that fails to implement a timely and systematic process for revoking access upon termination of employment or change in job role is equally problematic. This creates a persistent security gap, leaving the facility vulnerable to insider threats or accidental misuse of access privileges by former employees. Ethically, it demonstrates a lack of diligence in protecting sensitive areas and information. A third incorrect approach that does not include regular audits of access logs and user permissions is a failure to implement a crucial control mechanism. Audits are essential for detecting anomalies, ensuring compliance, and identifying potential security breaches. Without them, the facility operates with blind spots, making it difficult to identify and rectify policy violations or security weaknesses. This lack of oversight can lead to significant compliance issues and a failure to meet the duty of care expected in a healthcare setting. Professional decision-making in such situations requires a systematic approach. First, understanding the specific regulatory framework governing healthcare security in the relevant jurisdiction. Second, identifying the critical assets and areas requiring protection. Third, developing clear written policies and procedures for access granting, modification, and revocation. Fourth, implementing technological and procedural controls to enforce these policies. And fifth, establishing a robust auditing and review process to ensure ongoing effectiveness and compliance. Question 15. Implementation of a new emergency response plan for a large urban hospital, focusing on active shooter scenarios, requires a systematic evaluation process. Which of the following approaches best aligns with regulatory compliance and best practices for healthcare physical security? Option A. Focus the evaluation solely on the cost-effectiveness of the new security technologies integrated into the plan, assuming the core procedures are adequate. Option B. Rely on the initial risk assessment conducted 2 years ago and update the plan based on media reports of similar incidents in other healthcare facilities. Option C. Implement the plan immediately after its initial development and schedule a full review only if a significant security incident occurs. Option D. Conduct a tabletop exercise involving key department heads and security personnel, followed by a comprehensive review of the plan's effectiveness based on the exercise outcomes and recent industry best practices. The correct answer is D. Conduct a tabletop exercise involving key department heads and security personnel, followed by a comprehensive review of the plan's effectiveness based on the exercise outcomes and recent industry best practices. Explanation. This scenario is professionally challenging because healthcare facilities operate under stringent regulations designed to protect patient safety and ensure continuity of care during emergencies. Evaluating and improving emergency response plans requires a comprehensive understanding of these regulations, the specific risks faced by the facility, and the practical limitations of its resources. A failure to adequately assess and update these plans can have severe consequences, including patient harm, regulatory noncompliance, and reputational damage. The correct approach represents best professional practice because it directly addresses the core requirements of regulatory compliance and continuous improvement mandated by healthcare security standards. By involving a multidisciplinary team, conducting realistic drills, and incorporating lessons learned from actual events or exercises, the organization demonstrates a commitment to proactive risk management and adherence to established protocols. This iterative process ensures that the emergency response plan remains relevant, effective, and compliant with all applicable laws and guidelines, such as those potentially outlined by the Joint Commission or HIPAA security rule concerning contingency planning. An incorrect approach that relies solely on anecdotal evidence or infrequent, superficial reviews fails to meet the rigorous standards expected in healthcare security. Such an approach risks overlooking critical vulnerabilities or outdated procedures, leading to potential noncompliance with regulatory mandates that require documented, tested, and regularly updated emergency preparedness. For instance, a plan not regularly reviewed against evolving threats or regulatory changes could violate requirements for maintaining an effective contingency plan. Another incorrect approach that focuses only on external threat assessments without considering internal operational capabilities or staff training would be deficient. This neglects the practical implementation of the plan and the human element, which is crucial for successful emergency response, and could be a violation of general preparedness guidelines that emphasize comprehensive planning. A further incorrect approach that prioritizes cost-cutting over thorough plan evaluation might lead to the omission of essential elements or training, directly compromising patient safety and potentially violating regulations that mandate adequate resources for emergency preparedness. Professionals should employ a decision-making framework that begins with a thorough understanding of the regulatory landscape specific to healthcare physical security. This involves identifying all applicable federal, state, and local laws, as well as industry best practices and accreditation standards. The next step is to conduct a comprehensive risk assessment tailored to the facility's unique environment, considering potential threats and vulnerabilities. Based on this assessment, the emergency response plan should be developed or revised, ensuring it is actionable, clear, and addresses all critical areas. Crucially, the plan must be regularly tested through drills and exercises, with a robust mechanism for capturing lessons learned and incorporating them into future revisions. This cyclical process of assessment, planning, implementation, testing, and refinement is essential for maintaining an effective and compliant emergency response capability. Question 16. Stakeholder feedback indicates a need to upgrade the physical security infrastructure of a healthcare facility, including the installation of new surveillance cameras and enhanced access control systems. As the Certified Healthcare Physical Security Professional, CHPS, what is the most appropriate initial step to ensure compliance with federal regulations, particularly the Health Insurance Portability and Accountability Act, HIPAA? Option A. Immediately proceed with the installation of the most advanced surveillance and access control technologies available to ensure the highest level of physical security. Option B. Rely on existing security protocols and assume they will adequately protect PHI, focusing solely on the technical implementation of the new systems. Option C. Conduct a comprehensive risk assessment to identify potential vulnerabilities to protected health information. Phi. Introduced by the proposed physical security enhancements, involving the privacy officer and IT security in this process. Option D. Prioritize the speed of installation to address stakeholder concerns promptly, deferring detailed compliance reviews until after the systems are operational. The correct answer is C. Conduct a comprehensive risk assessment to identify potential vulnerabilities to protected health information. Phi. Introduced by the proposed physical security enhancements, involving the privacy officer and IT security in this process. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate need for enhanced physical security measures with the stringent regulatory requirements of HIPAA, specifically concerning the privacy and security of protected health information. Phi. Physical security upgrades, while necessary, must be implemented in a manner that does not inadvertently create new vulnerabilities for PHI or violate patient privacy rights. The physical security professional must navigate the complexities of access control, surveillance, and environmental safeguards while ensuring compliance with federal mandates. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a comprehensive risk assessment specifically tailored to the proposed physical security enhancements and their potential impact on PHI. This aligns directly with HIPAA security rule, which mandates that covered entities conduct risk analyses to identify potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic PHI. By involving the privacy officer and IT security, the physical security professional ensures that all relevant perspectives are considered, leading to a solution that enhances security without compromising regulatory compliance or patient privacy. This proactive, integrated approach is ethically sound and legally defensible. Incorrect approach is analysis. An approach that focuses solely on implementing the most advanced physical security technologies without a prior risk assessment fails to comply with HIPAA requirement for a thorough analysis of risks to PHI. This could lead to the inadvertent exposure of PHI through improperly secured surveillance systems or access logs, creating significant regulatory and ethical failures. An approach that prioritizes speed of implementation over thoroughness, bypassing consultation with the privacy officer and IT security, risks overlooking critical privacy and security implications. This can result in the implementation of security measures that inadvertently violate HIPAA privacy rule or security rule, leading to breaches and potential penalties. An approach that assumes existing security protocols are sufficient without evaluating the specific risks introduced by new physical security measures is negligent. HIPAA requires ongoing risk management. Failing to assess new threats or vulnerabilities introduced by upgrades is a direct contravention of the security rules mandate for regular review and updates to security measures. Professional reasoning. Professionals in this situation should employ a structured decision-making process that begins with understanding the specific regulatory landscape, HIPAA in this case. This involves identifying the core requirements related to the proposed action. Next, a thorough risk assessment should be conducted, considering all potential impacts on PHI. Collaboration with relevant stakeholders, such as privacy officers and IT security, is crucial for a holistic understanding of risks and compliance obligations. Finally, the chosen security solution must be evaluated against both security objectives and regulatory mandates, ensuring that all identified risks are mitigated in a compliant manner. Question 17. The assessment process reveals a pattern of escalating interpersonal conflicts and near-miss incidents involving agitated visitors and stressed staff within a busy emergency department. Which of the following strategies is most aligned with developing a comprehensive workplace violence prevention program in a U.S. healthcare setting, adhering to OSHA guidelines? Option A. Prioritizing budget allocation towards upgrading patient entertainment systems and improving waiting room comfort to reduce visitor frustration. Option B. Implementing a multi-layered approach that includes environmental modifications to enhance visibility and control access, developing clear reporting procedures for incidents and threats, and providing de-escalation and conflict resolution training for all staff, supplemented by post-incident support services. Option C. Conducting mandatory annual training sessions focused on recognizing warning signs of aggression and providing basic self-defense techniques for staff. Option D. Increasing the number of security guards stationed at the main entrance and in common areas, with a directive to respond to all reported disturbances. The correct answer is B. Implementing a multi-layered approach that includes environmental modifications to enhance visibility and control access, developing clear reporting procedures for incidents and threats, and providing de-escalation and conflict resolution training for all staff, supplemented by post-incident support services. Explanation. The assessment process reveals a complex interplay of environmental, behavioral, and systemic factors contributing to workplace violence risks within a healthcare facility. This scenario is professionally challenging because it requires a nuanced understanding of human behavior, physical security principles, and the specific regulatory landscape governing healthcare environments in the United States, particularly those enforced by agencies like OSHA. Developing an effective workplace violence prevention program necessitates a holistic approach that moves beyond superficial measures to address root causes and implement sustainable solutions. Careful judgment is required to prioritize interventions based on risk assessment, resource availability, and the potential impact on patient care and staff well-being, all while adhering to federal and state mandates. The correct approach, focusing on a multi-layered strategy that includes environmental design, administrative controls, and behavioral interventions, represents best professional practice. This aligns with OSHA General Duty Clause, which requires employers to provide a workplace free from recognized hazards that are causing or are likely to cause death or serious physical harm. A comprehensive program, as outlined in the correct option, directly addresses these recognized hazards by proactively mitigating risks. It incorporates physical security measures, environmental design, clear policies and procedures, administrative controls, and training and support systems, behavioral interventions, creating a robust defense against workplace violence. This approach is ethically sound as it prioritizes the safety and well-being of healthcare workers and patients. An incorrect approach that solely relies on reactive measures, such as increasing security personnel after incidents, fails to meet regulatory expectations. OSHA emphasizes proactive hazard identification and control. Relying solely on reactive measures is a failure to implement a recognized hazard control program and can be seen as a violation of the General Duty Clause by not taking reasonable steps to prevent foreseeable harm. Another incorrect approach that focuses exclusively on employee training without addressing environmental vulnerabilities or systemic issues is also insufficient. While training is a component, it cannot compensate for a lack of physical security or inadequate administrative policies. This approach neglects the systemic nature of risk and may lead to a false sense of security. A third incorrect approach that prioritizes cost-cutting over essential security measures demonstrates a disregard for employee safety and a failure to meet the employer's ethical and legal obligations. Such an approach directly contravenes the principle of providing a safe workplace and could lead to significant legal and reputational consequences. Professionals should employ a decision-making framework that begins with a thorough risk assessment, identifying specific vulnerabilities and potential threats. This assessment should inform the development of a layered prevention strategy, integrating physical security, administrative policies, and human factors. Regular review and adaptation of the program based on incident data, near misses, and evolving threats are crucial. Collaboration with law enforcement, mental health professionals, and employee representatives can enhance program effectiveness and ensure comprehensive coverage. The ultimate goal is to create a culture of safety where potential violence is recognized, reported, and addressed proactively. Question 18. Cost-benefit analysis shows that implementing comprehensive cybersecurity policies and procedures, including robust encryption, stringent access controls, regular staff training on data handling, and secure physical access to IT infrastructure, will significantly reduce the risk of data breaches and operational disruptions. Which of the following represents the most effective and compliant approach to implementing these policies and procedures within a U.S.-based healthcare organization? Option A. Focus exclusively on securing the physical perimeter of the facility and IT server rooms, believing that preventing unauthorized physical entry is the primary determinant of cybersecurity, and consider software-based security measures as secondary and less critical to overall protection. Option B. Develop and implement a layered security strategy that integrates technical, physical, and administrative safeguards, ensuring all policies and procedures are documented, regularly reviewed, and aligned with HIPAA security rule requirements, with a focus on continuous staff education and incident response preparedness. Option C. Implement a cost-saving approach by adopting only the minimum cybersecurity measures mandated by HIPAA, relying on the assumption that compliance equates to adequate security, and postponing any additional investments in training or advanced safeguards until a specific security incident occurs. Option D. Prioritize the implementation of advanced encryption technologies across all systems, assuming that strong technical controls will inherently mitigate most physical and human-related security risks, and deferring comprehensive staff training and physical access reviews to a later, less resource-intensive phase. The correct answer is B. Develop and implement a layered security strategy that integrates technical, physical, and administrative safeguards, ensuring all policies and procedures are documented, regularly reviewed, and aligned with HIPAA security rule requirements, with a focus on continuous staff education and incident response preparedness. Explanation. The scenario presents a common challenge in healthcare physical security, balancing the imperative to protect sensitive patient data and critical infrastructure with the financial realities of implementing robust cybersecurity measures. The professional challenge lies in translating a cost-benefit analysis into actionable policy and procedure that not only meets regulatory requirements, but also effectively mitigates risk without unduly burdening the organization. Careful judgment is required to prioritize investments and ensure that chosen strategies are both effective and sustainable. The correct approach represents best professional practice because it directly addresses the identified risks through a multi-layered strategy that aligns with the principles of the Health Insurance Portability and Accountability Act, HIPAA security rule. Specifically, it emphasizes the implementation of technical safeguards, encryption access controls, physical safeguards, secure areas, and administrative safeguards, training, incident response, as mandated by HIPAA. This comprehensive approach ensures that cybersecurity policies and procedures are not merely theoretical, but are actively integrated into the daily operations and physical security posture of the healthcare facility, thereby protecting electronic protected health information, E5, and maintaining operational continuity. An incorrect approach that focuses solely on technical solutions without addressing the human element or physical security vulnerabilities is professionally unacceptable. This failure would violate HIPAA requirement for administrative safeguards, which include security awareness and training programs. Neglecting physical security measures, such as restricting access to server rooms, would also be a significant regulatory failure, as HIPAA explicitly requires physical safeguards to protect EPHI from unauthorized access, theft, or damage. Furthermore, an approach that prioritizes cost savings over essential security controls, even if a cost-benefit analysis suggests it, would be an ethical failure, as it compromises the organization's duty to protect patient privacy and data integrity. Professionals should employ a decision-making framework that begins with a thorough risk assessment, identifying all potential threats and vulnerabilities to both physical and digital assets. This assessment should then inform the development of policies and procedures that are aligned with relevant regulations, such as HIPAA. The cost-benefit analysis should be used to prioritize the implementation of controls, ensuring that the most critical risks are addressed first. Crucially, the process must involve input from various stakeholders, including IT, physical security, legal, and clinical staff, to ensure that policies are practical, effective, and integrated across the organization. Regular review and updates to policies and procedures are essential to adapt to evolving threats and regulatory changes. Question 19. Investigation of a reported security breach involving unauthorized access to a restricted area within a healthcare facility requires the physical security professional to review surveillance footage. Which of the following approaches best aligns with regulatory requirements and professional best practices for analyzing this data? Option A. Conduct a comprehensive review of all surveillance footage from the past month, focusing on any activity within or near the restricted area, regardless of specific incident details, to identify any potential policy violations. Option B. Immediately download all available footage from the past week and share it with all security personnel for collaborative review to expedite the identification of the perpetrator. Option C. Access the surveillance system and review footage only from cameras covering the restricted area during the time frame of the reported breach, seeking specific evidence related to the unauthorized access and documenting the entire review process. Option D. Review footage from all cameras across the facility for the past 24 hours to identify any unusual activity that might be indirectly related to the breach, as a broader context might reveal contributing factors. The correct answer is A. Conduct a comprehensive review of all surveillance footage from the past month, focusing on any activity within or near the restricted area, regardless of specific incident details, to identify any potential policy violations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the need for thorough investigation with the stringent privacy and data retention regulations governing healthcare facilities. The physical security professional must meticulously analyze surveillance data to identify potential security breaches or policy violations without infringing upon patient privacy rights or violating HIPAA, Health Insurance Portability and Accountability Act regulations, specifically the Privacy Rule and Security Rule. The sheer volume of data, the potential for misinterpretation, and the legal ramifications of mishandling sensitive information necessitate a highly disciplined and compliant approach. Correct approach analysis. The correct approach involves a systematic, documented process that prioritizes compliance with HIPAA. This includes establishing clear protocols for data access, review, and retention, ensuring that only authorized personnel access the data for legitimate security purposes. The analysis must be focused on specific, articulable security concerns or reported incidents, avoiding broad, unfettered review. Documentation of the entire process, including the justification for the review, the scope of the data examined, and the findings, is crucial for demonstrating compliance and accountability. This aligns with HIPAA requirements for safeguarding protected health information, FI, and maintaining audit trails. Incorrect approaches analysis, reviewing surveillance footage without a specific, documented security incident, or a clear policy violation, is a significant regulatory and ethical failure. This broad, unfettered access can lead to the inadvertent discovery of PHI, violating HIPAA privacy rule. It also fails to adhere to the principle of least privilege, a cornerstone of information security and HIPAA security rule, which mandates that access to information be limited to what is necessary for a specific job function. Accessing surveillance data for personal curiosity or to investigate non-security-related matters is a severe ethical breach and a violation of HIPAA. This constitutes an unauthorized use and disclosure of PHI, exposing the organization to substantial legal penalties and reputational damage. It demonstrates a lack of professional integrity and disregard for patient privacy. Retaining surveillance data indefinitely without a defined retention policy or a specific legal or investigative need is also non-compliant. HIPAA requires organizations to have policies and procedures in place for data retention and disposal. Indefinite retention increases the risk of data breaches and makes it more difficult to manage and secure information, potentially violating the security rules requirements for data lifecycle management. Professional reasoning. When analyzing surveillance data for security incidents, a physical security professional must adopt a framework that prioritizes regulatory compliance, ethical conduct, and operational efficiency. This framework involves 1. Incident identification. Clearly define the security incident or concern that necessitates data review. 2. Policy and procedure adherence. Ensure all actions align with organizational policies and relevant regulations, particularly HIPAA. 3. Authorized access. Limit data access to authorized personnel with a legitimate need to know. 4. Scope limitation. Define the specific timeframes and camera feeds relevant to the investigation to minimize exposure to irrelevant data. 5. Documentation. Meticulously document all aspects of the review process, including justification, scope, findings, and any actions taken. 6. Data minimization and retention. Adhere to established data retention policies, securely disposing of data when no longer needed. 7. Privacy considerations. Continuously assess the potential for PHI exposure and implement safeguards to protect patient privacy. Question 20. What factors determine the prioritization of identified vulnerabilities during a healthcare physical security risk assessment, ensuring compliance with the HIPAA security rules mandate for risk analysis? Option A. The potential impact on patient safety and the confidentiality, integrity, and availability of electronic protected health information, EFI, alongside the likelihood of the vulnerability being exploited. Option B. Perceived novelty or media attention given to a particular type of threat, regardless of its specific applicability to the healthcare facility. Option C. The cost of implementing remediation measures for the vulnerability, with higher costs automatically leading to lower prioritization. Option D. The ease with which a vulnerability can be identified by external security auditors, irrespective of its actual risk to the organization. The correct answer is A. The potential impact on patient safety and the confidentiality, integrity, and availability of electronic protected health information, EFI, alongside the likelihood of the vulnerability being exploited. Explanation. Scenario analysis. Conducting vulnerability assessments in healthcare environments presents unique challenges due to the critical nature of patient care, the sensitive data handled, and the complex interplay of physical and digital security. Balancing the need for robust security measures with the imperative to maintain operational efficiency and patient access is a constant tension. Furthermore, the evolving threat landscape, including insider threats and sophisticated cyber-physical attacks, necessitates a dynamic and comprehensive assessment approach. The professional challenge lies in identifying and prioritizing risks that could impact patient safety, data integrity, and the continuity of healthcare services, all while adhering to stringent regulatory requirements. Correct approach analysis. The correct approach emphasizes a systematic, risk-based methodology that aligns with established healthcare security frameworks and regulatory mandates. This involves identifying critical assets, e.g., patient records, medical devices, critical infrastructure, analyzing potential threats, e.g., unauthorized access, equipment malfunction, natural disasters, evaluating existing controls, and determining the likelihood and impact of identified vulnerabilities. This aligns with the principles of HIPAA security rule, specifically the risk analysis requirement under Section 164, 308A1 Roman 2A and Section 164, 308A1 Roman 2B, which mandates a thorough risk analysis to identify and assess potential risks and vulnerabilities to the confidentiality, integrity, and availability of electronic protected health information, E5. A risk-based approach ensures that security efforts are focused on the most significant threats and vulnerabilities, leading to efficient allocation of resources and effective risk mitigation. It also supports the ethical obligation to protect patient privacy and safety. Incorrect approaches analysis, focusing solely on the most visible or recent threats without a comprehensive risk analysis, is an inadequate approach. This overlooks potential vulnerabilities that may not be immediately apparent but could have significant consequences, violating the spirit and letter of HIPAA risk analysis requirements. Such an approach can lead to misallocation of resources, leaving critical areas unprotected. Prioritizing security measures based on cost alone, without a thorough assessment of the associated risks and potential impact on patient care or data security, is also a failure. This can result in under-resourcing critical security controls or implementing ineffective solutions, potentially leading to breaches or disruptions that violate regulatory obligations and ethical duties. Implementing security measures based on anecdotal evidence or the practices of non-healthcare organizations is inappropriate. Healthcare environments have unique regulatory, operational, and patient-centric requirements that differ significantly from other sectors. Applying generic security practices without considering the specific healthcare context and its regulatory framework, like HIPAA, can lead to non-compliance and ineffective security. Professional reasoning. Professionals should adopt a structured, risk-based approach to vulnerability assessments in healthcare. This involves 1. Defining the scope. Clearly identify the systems, facilities, and data to be assessed. 2. Asset identification. Catalog all critical assets, including physical infrastructure, IT systems, medical devices, and sensitive data. 3. Threat identification. Brainstorm potential threats relevant to the healthcare environment, considering both internal and external sources. 4. Vulnerability identification. Systematically identify weaknesses in existing security controls that could be exploited by identified threats. 5. Risk analysis. Evaluate the likelihood of a threat exploiting a vulnerability and the potential impact on patient safety, data confidentiality, integrity, and availability. 6. Prioritization. Rank identified risks based on their severity. 7. Mitigation planning. Develop and implement strategies to reduce or eliminate prioritized risks. 8. Documentation and review. Maintain thorough records of the assessment process and findings, and schedule regular reviews and updates to account for changes in the threat landscape and organizational operations. This systematic process ensures compliance with regulations like HIPAA and upholds the ethical responsibility to protect patients and their data.